our secondary level, it's a university hospital, we face many of the challenges I already heard, but they are even worsened by the burden of education, and you need to evolve education and training in parallel with the evolution of the services. And also you are pressured by the quick and fast turnover of the technologies. And this is not only referred to the big technologies like the Da Vinci of the surgeons or the MRI, the last 3 Tesla, whatever the radiologists want, but it applies to a number of dimensions that make the secondary level even more challenging to implement the digital solutions. In our experience, we have been witnessing how digital solutions have the potential to address several of the challenges for hospitals. The first and most famous now is the availability of human resources. We have scarce human resources, and we have witnessed how if we manage to improve the identification of patients at high risk of revolving doors, which is mostly chronic, multimorbid, in collaboration with the territory, we can reduce the burden on human resources. And this is very hard to implement because what we hear talking about now is we need to focus on the community. We need to come out of the hospital, focus on community care, but there is still not enough focus on how the hospital has to integrate the services with the community in a real way, in a full integration, not only digital. The integration has to be full-fledged also on the organizational level, and also be paralleled by adequate education and training evolutions. We have witnessed how we face anti-obsolescence. So we need to, it's easy to buy the last Da Vinci. It's easy to buy the last MRI. What's not easy to do is get rid of the legacy systems that run the data flow and are embedded so deeply into the hospital. It's so hard to get rid of those that it's really painful to witness the good new programs you see in the European projects, and you cannot just integrate them because it's too hard, and you have to go through, the legacy system in the hospital that run the lab, that run everything. And data fragmentation and data fluxes is another thing we faced, because when we turn from a disease-centered system to a proactive health promotion and disease prevention system, you need more than clinical data. But this is very hard to convince people in the hospital that are very specialization siloed to take into consideration other types of data. Maybe we don't do enough to access social data and valorize them, standardize them, and make use of them in the framework of the clinical data. So how does a socioeconomic information modifies the interpretation of a clinical data, clinical value? So the digital solutions have been improving data fluxes, yes. And then we have been also witnessing how we can improve work life for clinicians, because we can use apps to talk to the patients, we can reduce congestion of the waiting list, and so on and so forth. I think that we don't look carefully enough at the evolution of the organization of the hospital. It's not only the entire system that is evolving. There is a deep transformation of the organization of the hospital. It's not anymore organized by function. It's becoming organized by processes. That means that you shift from a focus on restricted tasks, human resources that are very specifically trained and with specific tasks, to a teamwork. Teamwork means that you change the professional identity. This affects a lot the way the dynamics of the power in the usually running the hospital evolve. And you need to focus on the horizontal processes. No, the evolution, the innovation does not belong to one person. It's a shared success. So this means that you focus also better on the patient. And this is the real revolution that is should happen in the hospital, but we do not embrace it. So we don't recognize it, we don't acknowledge it, and we have problems with the performances, because performances, the way we are measured in the hospital, is medieval, is something that still counts the number of students enrolled in the hospital by number of beds. So this is something I cannot even hear. How can I be measured because you count the beds? If we are talking about telemedicine, integrated care, so there is something wrong in this vision, and we should make sure we have organizational experts